Congratulations on your pregnancy and thank you for choosing Netcells to store your baby's stem cells. First of all, let's go through the contents of the collection kit so that you're familiar with it. This is the Netcells Collection Kit. You may have already received the collection kit or you will be receiving it shortly. When you open the collection kit, you will see that there are two folders on the top. The client copy folder is for you to take home with you. It contains a copy of the storage agreement and informed consent for you to keep. There is a checklist of other documents that you can keep in there, including your results certificate and your invoice. The Netcells copy folder contains various documents that will need to be completed and returned with your sample to the laboratory. The birth identification form needs to be completed by the doctor after the birth of the baby, as it requires crucial information on the baby's delivery as well as the health of the mother. It is important to make sure that all the details are completed. Some important points to note are the section on the baby's details, the hemodilution, and the maternal blood draw section to be completed by your doctor, as well as where your doctor needs to sign. The maternal health questionnaire may be completed before the birth of the baby. It is based on the mother's health. However, if there is anything to note about the health on the father's side, it can be noted in the comments box. It is important that this document is signed and dated at the bottom. The storage agreement and informed consent. The first section contains the storage agreement, which needs to be initialed on each page by both parents, as well as signed and dated on the last page. The second section is the informed consent, which needs to be initialed on each page by the mother and signed and dated on the last page. The maternal blood information sheet contains information regarding the infectious diseases that are tested on the mother's blood. Copies of the Netcells umbilical cord blood and tissue collection protocols are included in each collection kit, should the doctor need to reference them at any time. Once the doctor has done the collection, it is the parent's responsibility to ensure that the box has been packaged correctly. The packaging instructions provide you with step-by-step instructions to follow to ensure that the sample arrives safely at the laboratory. The blue cord blood sticker is found in your folder and needs to be placed on the blood bag once the collection has been done. The cord blood collection bag is sterile and may not be opened before the collection takes place. Once the sample has been collected, packaged, and all the documents have been completed and signed, everything will be placed in the collection kit box, and the box will be placed inside the courier bag, where it will remain at room temperature until the courier arrives to collect the sample. Please keep the label on the outside of the bag to hand to the courier. Now I'm going to take you through the collection components inside the kit. The cord blood collection bag is a sterile bag which is not to be opened prior to the collection. It will be opened onto a sterile tray in theatre and is what your doctor will use to collect the umbilical cord blood. It is a 250 milliliter bag and the ideal collection is between 100 and 150 milliliters. The cord tissue collection tube is a tube filled with saline solution, which keeps the cord from drying out. Ideally, we need 10 to 15 centimeters of umbilical cord to be placed into this tube. The maternal blood test tube pack contains 4 blood tubes in it, as well as everything needed for the nurse to do the blood collection. Ideally, upon booking yourself into the hospital, you can ask the nurse to call Empath to come and do the collection for you, to avoid it being forgotten after birth. It is imperative that the nurse gives you the tubes back and that you keep them with you, as they need to be placed in the kit and returned to Netcells with the cord blood and tissue sample. The silver foil bag contains a Ziploc bag with a gel pack and absorbent cloth inside. The cord blood bag, cord tissue tube, and the packet of maternal blood tubes will be placed between the gel pack into the Ziploc bag and then into the silver foil bag. This is to ensure that the sample is kept at the correct temperature when it travels from the hospital to the laboratory. There are a number of important things to note, including your unique client number and the mother's name needs to be written on the side of the box where the collection kit number and expiry date are found. You will need to ensure that the following documents have your unique client registration number written on the bottom right-hand corner: the birth identification form, the maternal health questionnaire, and the storage agreement and informed consent. Each of the components of the collection kit needs to be labeled with your unique client registration number, the mother's name, as well as her ID number to ensure traceability. There is a parent checklist on the lid of the collection kit, should you get stuck at any stage and not know what to do next. We also have a packing the collection kit box video for you to watch to ensure that it has been packaged correctly before sending the box back to our laboratory. Please ensure that the collection kit is kept at room temperature and not placed in the fridge. Once everything is ready for collection, you will then give us a call on 084 664 4646 to notify us so that we can arrange for the courier to collect. This number can be found on the top of the Netcells Collection Kit. However, we recommend saving it on your phone now. Now that you are familiar with your kit, place it by your hospital bag so you don't forget it for the big day. When you arrive at the hospital, please remind your gynae and the hospital staff you are going to collect stem cells and give them the collection kit box. And that's it. If you have any queries along the way, please contact us and we will gladly assist you.